just dab across her whole face, and I want to get the product on her skin before I actually start my stroke. So I'm gonna do this throughout the whole face. And I'm gonna wipe some of that product every once in a while because it will drip into her ear. One of the things that you can do while you're learning, it takes practice to be able to watch the product and catch it from going into her ear or down the neck. So what I did while I was learning HydraFacials is actually just gave my client a tissue and I said, if I miss anything and it ends up in your ear or down your neck, go ahead and just wipe it off. I'm gonna try and catch all of it though. So that is something that you can do for your clients while you're learning. Okay, we're almost have product on her full face. Don't forget the upper lip and the nose. It can be kind of hard to get product on there because sometimes if they have smaller space to work with, it's gonna be harder to get suction. And then your stroke or your movement with this cleanse is going to be fast movement. So I like to take my middle finger, I'm gonna pull down on their jawline so that I have some taut tissue. And then I'm gonna do some quick strokes like this.
So like feathery, huh?
Kind of more feathery, yes. So she's getting a little bit of pink because this is going to be a little bit of exfoliation throughout this part of the treatment.
It's up and down?
I just go away from the nose a little bit because if I go this way, it's gonna be pulling up into her eye and then you're not gonna be able to get much movement through that area. So typically on the nose area, I'll go away. The forehead can be a little hard because it's more of a bony area, but just get on there what you can. It does help to hold your fingers more of in like a C position, like if you were dermaplaning or anything like that. When you guys look at the pattern on the screen, it tells you to do the full jawline and then both cheeks and then the forehead. This is how I learned. I learned to go on this cheek, up the forehead and down the other side. So that's just the pattern that I stick with. There's not a wrong way to do it. Okay, get her chin pretty good. Chin can be pretty hard too because of the curvature. And then the upper lip.
Do you do under here at all, or is it just that?
You can. Sometimes I'll go under this jawline a little bit right here, but I don't focus that much on the neck unless they have blemishes or anything right there that we want to focus on specifically.
So you would consider this place immediately right underneath the chin part of the neck?
Kind of yes and no. I usually just don't focus right there as much unless there's some kind of problem that I need to focus on. Okay, so we are done with that part. So I'm going to take this tip off and I'm going to throw it in the trash. We don't need to save those. They're one-time use. We don't cleanse them and use them again. Okay, if I hit next on my screen, it's now going to tell us choice of Glysal, and then our tip is going to be teal. So we're going to get this guy right here. I'm going to turn off my Active 4 cleanser. This little white piece right here, we're going to be unplugging from the handpiece. There is a lock and unlock on there. Make sure that you're looking at this and turning it towards unlock before you pull it out, because sometimes they just get ripped out and that breaks the inside of the handpiece. And then I'm going to take this and I'm going to put it upside down right there to sit. Okay, I'm going to take my vial and this just plugs straight into my handpiece. You should be able to get about 3 treatments out of each vial. I'm going to check the level. It's a little bit lower than halfway, if you guys can see that. That should be enough to get through my treatment. Should get about 3 treatments per vial. So I'm going to plug that in. I have my teal tip, I have my choice of Glysal, and this is going to be short feather strokes. And I'm going to hit go on my suction.